In this video, we'll look at medication options, usually called mood stabilizers. In this video series, we're focusing on the middle of the mood spectrum, not plain depression, but not manic depressive like bipolar 1 either. Not manic, that's the key. In this middle part of the spectrum, people don't need protection from a full manic episode. So you don't need the medications usually required over here, bipolar 1, like full dose lithium. And you don't need the strongest medications, sometimes called antipsychotics, because depression is the main problem here in the middle of the mood spectrum. So treatments should have an antidepressant effect while at the same time having a mood stabilizing effect. And of course, it would be nice if the medication was low risk, because if it works, most people will need to stay on it for months to really see what life is like with a stable mood. After that, you can discuss with your provider the pros and cons of tapering off. And if you ever taper, it's important not to lose the gains you've achieved, so obviously it would be ideal to have your treatment team in the loop at that point. Anyway, the point is, we should be looking for medications with very low risk, and one with few or no side effects, and one that's not expensive to you or the medical care system. And when you take that list of ideal characteristics, it points at one medication in particular, as shown in these treatment guidelines from an international group of mood specialists. Here's their picture version. When the main problem is depression and when mania is not a risk, the guidelines suggest a medication called lamotrigine. And notice, if mania is not a risk, then a lot of other medications don't need to be considered. Since lamotrigine stands out as a medication for the middle of the mood spectrum, here's a little bit more about it. People who take it, most of them have no side effects at all. Maybe a little nausea when they first start, and that's easily fixed by slowing down the routine dose increase or going back down a step. Sometimes a headache, same story, slow down or go back a step. Neither of these persists long-term, and neither is a reason to give up. Now, of course, starting a medication like this is a big step. Nothing is risk-free, so you're comparing the risks of a medication with the risks of continuing to have the symptoms you've been having. Many people will want to make sure that they can't manage their depression without a pill of some sort, and that's good to a point. But if you're considering lamotrigine, well, of course, you're going to Google it, right? Looking at reliable sites, you'll see there's one big risk, a 1 in 2,000 risk of a severe allergic reaction called Stevens-Johnson syndrome, or a few other long acronyms. On some sites, you'll see a rate of 1 in 1,000, but the number, getting it exactly right, doesn't really matter, because the point is this allergic reaction, like it's a severe skin rash, is not exactly rare, but it's certainly not common. Here's one way to look at that. For a specialist like me, who started patients on lamotrigine hundreds and hundreds of times, I'll see one of these reactions in my entire practicing lifetime on average. So, since that's just about the only risk of lamotrigine, you're going to hear about it, the rash, which is made trickier by the fact that 1 person in 10 gets a mild rash that isn't dangerous. Oh great, we just finished telling you about Stevens-Johnson syndrome and then you get a rash? Great. Just make sure you tell the person who prescribed it for you that you've got something going on, and they'll tell you what to do. Here's one more thing about those guidelines. Notice that lithium is up here. Lithium is a scary word for some people, so I'll tell you just a little bit more about that one too. You can think of lithium that's shown here as full dose lithium, which does have some challenges. Blood tests for one thing, and side effects sometimes, higher dose range that can be hard to handle. But low-dose lithium is almost like a different medication. It has fewer risks, and by starting at the lowest available dose, we can practically assure that you have no side effects at all, because the game plan is, if you get a side effect, you turn the dose back down a step till it goes away. So the big advantage of low-dose lithium, in addition to antidepressant and mood-stabilizing effects, is an anti-suicide effect. People who are taking even the lowest dose of lithium just aren't as likely to make that fatal choice. So if you've been thinking about suicide, you should let your treatment team know. Low-dose lithium might be worth considering. In summary, lamotrigine is one of the main options for mid-mood spectrum depression, and perhaps consideration of low-dose lithium. The next and last video in this series looks at the role, or lack of role for the most part, of antidepressants for the mid-mood spectrum.